So we have covered the fainting, right? We covered the unconsciousness, right?
Yeah.
So now we're talking about asthma, okay? Asthma. Asthma is respiratory in nature, respiratory. So asthma is, first thing that will occur to your mind is that asthma is respiratory in nature. Respiratory in nature, and I'm going to tell you why it is that. But please note that asthma is respiratory. So when we talk about respiratory, so we're talking about something that affects respiratory system. Okay, respiratory system. Let's briefly talk about that. I take 1 or 2 minutes to talk about respiratory system so that you see where asthma comes in. So when you talk about respiratory system, this is the system that is responsible for our gas exchange, breathing in, breathing out. Okay, you need oxygen to survive. Carbon dioxide must go. Okay, while oxygen is coming, carbon dioxide is leaving. So the members of our body that are responsible for that belong to respiratory system. And the main organ there is lungs. So lungs, okay. Then you have airway. So airway is also a key player. Airway, and then you have the diaphragm. So diaphragm is the main organ for breathing. So it is this dome shaped. This is the biggest muscle for breathing. So when you breathe, it goes like this. Okay, so it's called that. So those are the 3 key players when you talk about respiratory system. So the lungs, the airway. Remember, the airway is a tube. Okay, is a passage through which gas goes. Okay, and they connect the lungs to the outside world through the nostril. So these 2 openings, nostril. So the link between lungs and outside world is through the airway. Okay. So now what is asthma? Now that we know. So what is asthma? So asthma is inflammatory. So asthma this is the official definition of asthma, inflammatory airway condition. Now, you can see that airway is part of the definition, and airway is a key player in respiratory system. So this is the reason why I tell you that asthma is respiratory in nature, because it directly affects a key player in respiratory system, inflammatory airway condition. Okay, many things can trigger, many things can cause asthma. It's a condition. Some people have it. They were born with it. So whenever they come in contact with some things, some environment, some event, they begin to experience it. Some people, cold weather can trigger that. Some people, stress can trigger that. Some people, exercise. There are some people, if you subject them to rigorous, strenuous exercise, they begin to have asthma. Some people, what else can cause asthma? Chemical vapors, animals. Some people, they come across some animals, they begin to have it. Okay? So those are some of the causes of asthma in some people. Some people, as they grow, they overgrow it. Okay, why some people, they live with it even into their adult life. Okay, They can only manage it, but it doesn't go away. Some people, it goes away. Some people, when they change environment, it goes away.
Some flowers.
It's a what?
Flower.
Oh, okay, yes, yeah, pollen and all that, pollen, exactly. Yeah. Okay, and then we're going to talk more about that when we come to allergies. Okay, yes, okay. So, but it is inflammatory. Now that means whether it is coming from cold weather, whether it is coming from strenuous exercise, whether it is coming from chemical vapor, whether it's coming from strenuous activities, everything boils down to the fact that there is inflammatory activities going on along the airway. And one of the things you see here is there's usually some muscle spasm when that happens. Okay? So again, let us draw something like this. Let's assume, for sake of argument, that airway is like this, is a connection, and this is the lungs, right? So, and this is the nostril. Okay, let's say, for simplicity's sake, let's assume this is the nostril leading to outside. Okay, so there's movement here. Remember that movement in and out is breathing. This is the only movement allowed within the airway. The only movement, I hope you are taking note of what I'm saying. The only movement allowed within the airway, which is a passage, is breathing. And breathing is movement of air in and out. In and out. Inhalation and exhalation. When you exhale, you breathe out. That is the other way. So this airway must be free for you to breathe well. Okay? The airway must be free. No congestion, no clogging. Nothing should crowd it. It's supposed to be patent. Smooth movement, okay, demands that the airway must be free of anything. But when asthma happens, okay, it produces mucus along the airway. So it produces mucus, which is sticky. Mucus is just sticky substance. Some people may have excessive, okay, it varies from people to people. Some people, this mucus may be massive. When that happens, it produces a lot of mucus, and the mucus will occupy some part of the airway. So now, this is where the problem comes in. Now remember that there should be movement here, right? Movement here. Now it is no longer smooth because of the mucus. Yeah, because of the mucus that is produced, that movement is no longer free. So this is why people that have asthma, they have a lot of issues with breathing, mainly breathing, because the airway is no longer free. Remember that the only activity allowed within the airway is breathing. Now the road, if you permit me to use the road to describe airway, is like road. Airway is like road.
Traffic.
Yes, traffic. While breathing is like vehicle that goes through the road. So if the road is not free, if construction is happening and the roads are blocked or reduced, you see the people will slow down. Okay? Yes, people slow down. That's actually how you can understand this. Okay? So when this happens, what are the signs and symptoms of asthma? Usually breathing. Breathing will go high. The respiration rate will go high. So increase rate of breathing. So breathing will be, okay, breathing rate goes up. Breathing rate is higher than normal. Okay, higher than what? Because now, why is that? The person is breathing more than. Remember, I told you for an adult who is at rest, how many times are you supposed to be breathing? 12 to 20 in 1 minute. So, for an adult, 12 to 20 times. This is the rate, breathing rate, 12 to 20 times in 1 minute. So, but if somebody is having asthma, the person will be breathing more than this number because the rate will go up. So, another thing you see is the use of accessory muscles. Accessory muscles for breathing. The use of accessory muscles for what? Breathing. What are the accessory muscles? Normally, I told you that the main muscle for breathing is the diaphragm. That is the main muscle. So if everything is okay, you don't need assistance because this muscle is enough. It does the job perfectly. It doesn't need the help from anybody. But during asthma, breathing is no longer smooth because the airway is crowded, congested. So breathing is not easy. This person is laboring to breathe. This person is struggling to breathe. Now diaphragm needs help. That's why the accessory muscles are engaged. The neck muscles will now come in to help. The intercostal muscles will now kick in to help. Because diaphragm is asking them to help me. I can no longer do this alone. Because it's getting too much for me. I need the help. So the neck muscles, they are available. The intercostal muscles, they are available. Now they come to assist. That's why when you look at people who are having asthma attack, look at the strain on their neck. You can see the movement. Their chest will tell you that breathing is no longer smooth. Because those rib, the muscles between the ribs, they are not helping. They are not coming to assist. Okay? So that one thing another thing you see during asthma. Number 3 is position. So the person will go, tripod position is another thing you see. Tripod position. Tripod, what? Position. So tripod position is bend. So bend. So when you see people who are having asthma attack, most of the time they bend. And it's natural. This is the way the body is fighting back. This is the way the body is trying to help with the breathing especially. Remember that breathing is very difficult now. Laboring. The person is struggling, laboring to breathe. So anything your body can do, okay, your body is using accessory muscle. That is a way to fight back. Okay? Now your body is also asking you to bend. Because when you bend, the chest cavity will expand. And that will help you to breathe. When you bend. When you bend, this is called tripod, you breathe better. Because your chest will expand and then giving you more room for breathing. So that's what happens here. Okay? What else do you see? Number 4, the person becomes restlessness is there. So the person becomes restlessness is there. And in fact, before that, let's make this, okay, let's put that there. The number 4 is coughing. Coughing. Or what? Wheezing. Coughing or wheezing is always there. Coughing. Because again, everything boiling down to the airway. That airway that is not congested. So wheezing is a whistling noise. Whistling. Okay, suggesting that the airway is no longer free. So you hear that? Yes. That happens with the breathing out because of the airway that is there. So restlessness, coughing or wheezing, and then you also have anxiety. Okay, anxiety and all that. Okay. Excuse me, do you have any question? So these are typical signs and symptoms of asthma. Okay, and asthma is okay. If you use RABC now, if you use RABC, okay, RABC, and this is your patient showing all these signs, and you know during your primary survey, you are assessing RABC to know whether this is a life-threatening condition. Remember, that is the primary reason why you do what? Primary survey. You want to quickly assess your patient for RABC to determine if this is life-threatening or not. Okay, look at your patient here. Breathing rate increases. That is B.
B.
Yeah.
Use of accessory muscle for breathing. Again, that is B. Because breathing is not easy. Tripod position. Why is the person bending? Because breathing is difficult. You see, asthma is respiratory. You can see the reason why I tell you is respiratory in nature. You can see that breathing is affected the most. Okay, now look at restlessness. I will put it here. R. Coughing and wheezing. A. In fact, there's one too. Skin color. Skin color is pale. Okay, it begin to go pale. And then if you see that, paleness is what? C, circulation. Coughing and wheezing. So you can see that
Critical
this
condition.
is, yeah, this is critical, life-threatening. Look, almost all of them. If you see anybody with this configuration, that is life-threatening. If you are not calling 911 here, that means you don't know what you are doing. If you see anybody with this type of configuration, coloration, you see somebody, all the 4 letters are affected. In fact, anxiety too is here. Because when you're anxious, you're restless, you're not focusing, your level of consciousness will drop, obviously. This is what? That's why asthma is life-threatening. Why? Because of this. So asthma is a life-threatening condition. People that have this condition, they carry their medication with them. The inhaler, the puffer, the one they inhale. So inhaler is a bronchial dilator. So what it does is to dilate the airway, widen it, so that you have more space to breathe. Remember the mucus that occupy that airway. If you widen it, you will free some space. So that's what that inhaler does. So even if somebody has the inhaler, it doesn't stop you from calling 911. So it is important. In fact, recently there was a boy that died in a school, 13-year-old boy in grade 8, from asthma. Yes, it's in the news. I have it in the news. If you Google it, maybe it's still in the news now. And it happened recently, not too long ago, maybe a couple of months ago. I think either US or somewhere, but in North America, not far from here. Yes. So he has a very severe asthma. And because of that, even though he has the inhaler, but the inhaler did not help at that time. So that's why I'm telling you that for the fact that somebody has the inhaler does not stop you from calling 911. Because the inhaler may fail, especially depending on how critical it is that day. So that's why 911 is important, despite having the medication, the inhaler, okay? That does not stop you from calling The inhaler does not stop you from calling 911. Calling 911 is a backup, is important in case this does not work. So 911, remember, they come with oxygen. They will come with many things that we don't have. As first aiders, we are doing basic care. The basic care is important, but usually not ultimate. It's not treatment. So you need them when you are dealing with a life-threatening condition like this. You need to call 911, then do your first aid. Part of the first aid you do is telling the person to lean forward, which is tripod, because it will give the person more room to breathe. You ask the person, do you have an inhaler? If yes, then tell the person to use it. Remember, there are 5 rights to medication. This course, I know it's more than 5, but for this course, there are 5 rights. So we don't give medication, but we can assist. 5 rights to medication, 5 rights to medication. Okay, assistance or administration. Okay, right patient. So make sure that medication is for the right patient. Okay, right patient, right time. Okay, no, right medication. Okay, so it's also right medication. So right time. So it's given at the right time. Right route. Okay, right dose. Okay, dosage. Okay, and then right route. So route means the channel through which it is going inside. Is it swallow? Is it by IV? Is it subcutaneous, like insulin that you deposit in subcutaneously? So those are the. So make sure those rights are there, and then the patient should be able to help, to be able to give it to himself or herself. Do you have any questions? So this is asthma topic. The book has more details. This is just summary and overview of that. Okay? All right. Any question? Okay. So thank you so much. Thank you. Thank you.